So Peyronie's disease is an interesting condition that's not very well understood, and yet it's relatively common in the community. It's a condition that develops in the penis and it causes the man to get a deformity of the shape of his erection. Round about 10% of men develop Peyronie's disease, but it might only be a very minor little curvature or something that they hardly notice. However, many men will present with quite significant curvatures. It's called Peyronie's disease because it was first described back in 1743 by a French doctor, Peyronie. It's not really a disease, it's a condition that develops. We think there are genetic factors, that is, some men are more prone to develop it than others, but essentially what happens is there's some degree of trauma to the penis. Now that might be an incident where the penis gets bent, the man remembers something happens, but most commonly there's no memory of any incident, but the penis probably just bends and moves a little bit over time and eventually develops a little bit of damage within it. The damage itself is not the Peyronie's disease, it's how the body reacts to that damage, and this is why this condition probably has genetic factors behind it. The body tries to heal up the damaged area, but it actually heals it up too much and it causes scar tissue to develop inside the penis. And scar tissue has several characteristics to it. One is it tends to contract, and the other is it won't stretch. So the problem if you have scar tissue in the penis is when you have an erection, the penis will bend in the direction of the scar tissue. There can also be pain sometimes because there's inflammation associated with the scar tissue. There's a lump that some men present with, they get worried they can feel something in the penis. And sometimes Peyronie's disease also affects the strength or the quality of their erection. So it can be quite a devastating condition when it's severe, and it can really affect men in their self-esteem and in their relationships, and many men get quite depressed about it. The natural history of Peyronie's disease is from when it starts to when it reaches what we call a stable or a chronic phase is many months. It can even be up to 12 months. But typically by about 6 months most men have got an established problem. That is, they have a curvature that won't get better or won't get worse. Their discomfort's gone away, and that's often when they come to seek treatment.